presbyopia. It's a funny word, but what is it? What does it mean? And why should you care? Because I think we all should, according to our next guest especially. She's going to explain. Her name is Dr. France Corriveu. She's an optometrist with IRIS Optometrist. Welcome to the show.
Thank you.
Well, thank you for joining us. Now, this is a funny word, presbyopia. A lot of people may not know what it is.
Everyone's scratching their head at home.
What? Now, we were talking to an optometrist, so we can only assume this has something to do with our eyes, right?
Exactly, yes. Actually, presbyopia is a normal aging process of the eyes. With time, the muscles in our eyes and the lens that we have in our eyes, they lose their flexibility.
Okay.
And with that, what happens is that you are having trouble reading up close. And that usually happens around 40, 45 when people have to push away what they're reading, and at one point their arms are not long enough, and that's when you need reading glasses.
Is this avoidable?
No. Unfortunately, presbyopia is a normal aging process, just like gray hair, just like wrinkles.
Okay.
It is something that will happen with time. Some people will have it younger, some people will have it older. Unfortunately, at this point, there's not really anything we can do to stop it or prevent it.
Okay.
But it is something that we can correct for sure.
Okay. Are certain people more predisposed to getting a more severe case of presbyopia?
Actually, no, because everybody has the same flexibility of the muscles at one point, and we all lose it.
Okay.
So we'll all get kind of the same problems.
Well, you did mention we can correct it.
Yes.
How do you go about correcting it?
There's actually a few ways. Of course, there's glasses. There's also contact lenses, multifocal contact lenses. Right. And now at IRIS, we do what we call laser blended vision, which is laser that allows you to correct both your distance vision and your reading vision.
Really?
Yes.
That's amazing. I was going to ask you about that because there seems to be nothing you can't do with lasers these days.
Yes. It's fairly new, but we've been having really great results.
Okay.
So,
and also, I guess when people are thinking about presbyopia, or perhaps they think that maybe they're in that age range, you said about 40 years of age.
Exactly.
What signs should they be looking for?
Tired eyes at the end of the day, having trouble doing focus. Those are the first signs, and then obviously reading will get harder and harder. It will start with small peel bottles and really, really small things, and then eventually even reading the newspaper, reading a book will get really difficult.
Are there other age-related eye diseases that happen to us too as we end up moving into our later years?
There are cataracts that also happen to everybody at one point in their life. There's also glaucoma, who's more present in older people, and there's also macular degeneration. So macular degeneration is a disease that affects the central vision, and that's something that we really need to look at and make sure that we don't get it. So
we're all predisposed to cataracts as well?
Yes.
Is there any prevention to that? Is that something that, again, is just you can't avoid it?
To delay the apparition of cataract, there's one thing you can do, and it's to wear sunglasses.
Okay.
Ah, that is fantastic.
And I guess you have to be careful too what kind of sunglasses you buy, because we're not talking your gas station $7.99 sunglasses here, which I used to buy and get in trouble about that.
You have to make sure that your sunglasses are going to block 100% of UVA and UVB.
Okay.
And at IRIS, we always recommend that you do a full eye exam with your own optometrist, and then you are going to meet with eye care specialists that's going to make sure the glasses fit you well on top of giving you good protection.
And how often should people be seeing their optometrist?
We usually recommend an exam every 2 years for everybody in between 19 and 65, unless you have other eye issues. And then younger and older than that, we usually recommend once a year.
And you also talked about macular degeneration as well as glaucoma.
Yes.
Those are two different things, but how do we protect ourselves or prevent the progression of those diseases?
Well, glaucoma, if you visit your optometrist regularly, will check your pressure every time you come in, and glaucoma is high pressure in the eyes that's causing damages to your eyes. So if we check your pressure every 1 to 2 years, then we'll make sure it's not too high, and if it is too high, we'll go with treatment. Macular degeneration, again, if you visit your optometrist, you will make sure there's no signs of it, and there's also sunglasses again, and omega-3s that will help as well. well.
As she's looking into my eyes, I'm wondering, is she reading something in my eyes? Is there something going on in there?
Not at all.
Well, a lot of great information,
Yeah.
definitely important information for all of us to know. Thank you so much for coming in today and educating us.
Thank you for having me.
Thank you. Well, coming up next, we are talking about designing the interior of your home with a Scandinavian flair. That's right after this.